Hi, this is my sister Alyssa. She is going to be the patient in case C today. She has signed the waiver online. I will submit it online also, but that is just confirmation that she has signed it before we started. So I'm going to go ahead and get started. So hi, Alyssa. My name is Levi. I'm a student physical therapist. I'm going to be going through a few motions with you and some muscle testing. And to do that to the best of my ability, it's going to be beneficial if I can put my hands in your head and neck area and also your low back area. Is that okay with you?
Yes, that's fine.
Okay, and what I'm going to end up doing is I'm going to kind of, with this area, which may be the most uncomfortable, it shouldn't be uncomfortable at all. If you're uncomfortable anytime, just tell me and I'll stop whatever I'm doing. But I'm going to kind of go here to your hip bones, kind of walk them back to the little hip pointers back here, and go in between them to your spine, and put a little mark there. And I'm just going to kind of use that as a measurement point. Okay? So what I'm going to have you do is, if you could go ahead and stand up for me, that would be great. So I'm going to have you go ahead and look the other direction. Okay, and could you lift your shirt up slightly for me? All right, thank you. So what I'm going to do is I'm just going to kind of feel for those hip bones, and then I'm going to work my way down to the hip pointers, and then I'm going to go, and could you roll your pants down for me slightly? Okay, so there's a mark here on S2, and I'm just going to measure up 15 centimeters from this. Okay, and then I'm going to lift your shirt up slightly if that's okay.
Yep, that's fine.
Okay, and there's a mark here on 15 centimeters up. So what I'm going to have you do, Alyssa, is I'm just going to have you reach forward and try to touch your toes. Make sure you don't go off balance or anything. I'm going to be here to guard you, but if you could go ahead and do that for me. Okay. So reach down. All right, I'm just going to give you a little bit of overpressure here. Okay, and kind of, you go ahead and come back up. All right, and go ahead and do that one more time for me.
Okay.
All right, I'm going to measure this time. Okay, so that is 25 centimeters. So that, again, tape measure is just comparable to itself for individualized for the patient. If this was using degrees, normal for lumbar flexion is 0 degrees to 50 degrees. So you can go ahead, Alyssa, and you can hop on the mat table and you can put your head up here in the towel. Okay, next thing I'm going to do is I'm actually going to, if it's okay with you, I'm going to put this in your forehead, and I'm going to see how far you can rotate to the side, so just looking over your shoulder. So if you could you go ahead and look over towards the wall over there, like towards my hand right here. Okay, and I'm just going to give you a little pressure, see if you can go. Okay, great, and come back up to the top. All right, now I'm going to put this little guy on. Could you make sure you're just looking straight up towards the ceiling for me? Okay. All right, and then could you go ahead and look the same way towards my fingers over here? Okay. All right, that's about, and go ahead and come back up. It's about 35 degrees. Normal for cervical rotation is 0 degrees to 80 degrees. All right, Alyssa, so now I'm gonna do a couple muscle tests with you. So the first one I'm going to do in this position is I'm going to have you go ahead, and if you could look towards my hand over here as far as you can. Okay, great. So what I'm going to do is I'm going to kind of put my hand on the side of your head over here and kind of resist. I want you to come back up and look towards the ceiling. Okay, so whenever you're ready, I'm going to go ahead and have you try to come up towards the ceiling, okay? So push, 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 push. Push, 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 push. Okay, great. So I would give her a 3+ out of 5. Well, a 3 out of 5 for this because there's not really gravity minimal, but she got some resistance, minimal resistance, overcame the minimal resistance. So one of the muscles with that is the left sternocleidomastoid, because it does contralateral rotation, so it does rotation to the right. To make sure I compare this properly, along with a goniometric movement for cervical rotation. I would do it bilaterally, so to the other side, just to give it a comparable, make sure it's 3 out of 5, 5 out of 5, that's something like that. Compared to the other side, make sure it's normal for, not normal for them on both sides. And then, yeah. So, all right, Alyssa. So next thing I'm gonna have you do is I'm gonna support your legs, and I'm gonna support them down here, and I'm gonna have you kind of put your hands behind your head, and I'm gonna have you lift all the way up for me. And real quick, just to note, I think I mentioned it, but the cervical rotation doesn't have a great gravity minimal position, except for if you did it seated. That'd be it. But all right, Alyssa. So I'm gonna support your legs for you, and if you could go ahead and just kind of sit up all the way for me.
Okay.
Okay. So I'm gonna go ahead and support you here, and then whenever you're ready, go ahead and try to come all the way up for me. Okay.
Okay.
Okay. So whenever you're ready. Come on, push, 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 push. Come on, up, up, up. All right, good job. Okay, and go back down.
Okay.
All right. So I give her a 4 out of 5 because she struggled a little bit coming up, but she didn't make it all the way up. The gravity minimal, or not necessarily gravity minimal, but the minimal position for this would be if you put your arms at the side whenever she's doing this. So if she were to put her arms at the side and I were to support her legs and she were to come up, that would be a 3. And then a 2 would just be a palpable contraction. A 1 would be a palpable contraction. 2 would just be partial range in that with the arms at the side. One of the muscles tested in that motion is rectus abdominis. And then also, I don't know if I mentioned, actually I did mention range of motion for both of them. So 0 degrees, 50 degrees for lumbar flexion, and then 0 degrees to 80 degrees for cervical rotation. But yes, so Alyssa, do you have any questions for me?
No.
Okay, great. Thank you very much.
Okay, thank you.